Hi, my name is Steve Carrithers, and I am an SBIR award winner. I'm working with Accelerate Health to actually state some of the problems and issues that we've had, more or less called SBIR war stories. What I've found is some of the earlier problems with some of our first biotech companies is that we did not evaluate and do the due diligence on our clinical indication of our potential product. What we did is we got our SBIR awards. This was based and founded upon sound scientific evidence, mechanistic data, hypothesis-driven research. But what we found is once we got to the phase 1 and phase 2 through the proof of concept, feasibility studies, is that even though it was approved by the FDA, we found that no physician really wanted to use it. And the reason is because it did not influence physician care. What you would want to do is find that clinical indication of how your kit, your diagnostic, or even your therapeutic might influence patient adherence or patient care. The physician cares about this, and this is how it would be used, this is how it would be ordered. Unfortunately, we got to a point where we almost went bankrupt. We had to pivot, and we had to make decisions based on what evidence we had and what clinical indication our kit truly was meant for. So when we got to the true market, there are lessons that we learned. First of all, mice are not humans. Rats are not humans. Even though there was a lot of sound evidence and sound scientific research behind it, we found that animals are just not humans, and it only takes you so far. The second point is to work backwards. We wanted to find that clinical indication and then work backwards to a point where if we were to move forwards from the bench top, they would meet in the middle and we can actually achieve these milestones. Then we can write an SBIR grant. From here on out, when we license technology, we always work backwards. We look for the clinical indication. We look for that point where it is going to influence patient care and fit within the decision-making process by the physician. Now we don't make those mistakes. So when we look at diagnostics, it helps us out in the future. But please, don't make the same mistake we did. It almost shot us in the foot. Thank you.